Radon is a very serious problem in Kentucky. Radon is actually found everywhere in Kentucky, but we do have higher risk areas than others. We have a swath going from south central Kentucky up through central Kentucky and up through northern Kentucky that's extremely high. But in general in Kentucky, they predict that about 1 in 5 homes has radon trapped inside of it. So that's quite a few homes. And in some places, particularly in central, south central and northern Kentucky, it can be up to 40% of the homes have radon exposure in them. So it's really, really critical that healthcare providers be part of the solution and help us talk to patients and families about testing for radon. Radon exposure creates some serious health effects, primarily lung cancer. We don't have a necessary research that we need to understand whether radon exposure leads to other cancers. We could guess that perhaps thyroid cancer may be associated, but frankly, we don't yet have that research. But we have plenty of science. In fact, the debate is over about radon. Radon is the second leading cause of lung cancer. Radon-induced lung cancer occurs in about 20,000 cases a year are from radon-induced lung cancer. What's important, though, is that those 20,000 cases are primarily people who are exposed to both radon and tobacco smoke. I always say that if you had 1,000 people exposed to 4 picocuries per liter of radon in their lifetime, 7 of those 1,000 would be never smokers, never exposed to tobacco smoke. But 62 of those 1,000 would be exposed to both secondhand smoke and radon together. So there's this synergistic effect of radon and secondhand smoke and firsthand smoke. Radon and secondhand smoke combine to form a toxic chemical, really, that puts people at risk of lung cancer. So the particles stick together and oftentimes will stick on walls, on furniture, on carpet, and then they do what's called off-gassing, and all of those particles get into the air and people breathe them in the home. So we know that when you're exposed to secondhand smoke and radon, you're about 10 times more likely to get lung cancer compared to whether you're never exposed to radon or secondhand smoke or firsthand smoke. So there's this, what we call a synergistic effect between the two environmental toxicants. And as long as you know that, you can reduce both. We could really eliminate lung cancer if we eliminated those 3 exposures. Healthcare providers play an enormous role in reducing radon exposure. They can talk to every patient at every visit about radon and lung cancer risk reduction, which includes talking to them about quitting smoking, reducing radon, testing and fixing radon, and reducing secondhand smoke exposure in their home and their car. So all of that should just really be the standard of care for every visit, every time. And even if you don't see patients individually, if you're a public health person and you plan programs for whole communities, you can certainly fit it into writing an article for the newspaper. You can have a talk show on the radio or the television about radon during Radon Action Month, which is in January and in October. There's a lot of opportunities that healthcare providers can take to educate the public about lung cancer prevention. I mean, after all, if we all spoke about lung cancer prevention, we would make a huge dent in lung cancer.